I'm Judy Wolfe. I work at Northern Navajo Medical Center in Shiprock, which is Indian Health Service. I have been there for quite some time. Maybe some people think too long, but so I'm happy to do this in this pretty uh, brief introduction into strangulation. And I currently work under the Women's Health Program with the sexual assault as a sexual assault care coordinator under the community health program at Shiprock, which is really separate from the hospital. And so I actually could not remember how to do the APA style for doing slides. And so I wanted to give credit to Gail Strack, who has come to Shiprock to do some presentations. And so I did take direct information from her slides. And so I'm indicating that by GS. And then also the Training Institute of Strangulation Prevention, I'm indicating by SP, which is really a great resource. And I have to tell you, I'm over in Kelsey's office because this is my first experience doing this on Zoom. And I'm glad I came here because she really had to help me through, and I could not have done this on my own. And so this is a really new technology for me, but it's really pretty cool. So the objectives for doing this, I really want people to understand the lethality of strangulation, and then to understand some of the potential short-term and long-term health risks from strangulation, and the really importance of a basic assessment of strangulation and of advocating for an individual. So as Kelsey mentioned, that this presentation may trigger some really traumatic memories for yourself or maybe family members or someone that you know. And so please seek out support from a trusted individual or agency to take care of yourself. And you are not alone. Often people think they are alone and that they carry this unique experience by themselves. And it's not the case. So please seek out support if you need it. So Gail Strack, who is an attorney and one of the co-developers of the Institute for Strangulation Prevention, this quote from her is, "The minute you put pressure on someone's neck, you are really announcing that you are a killer." And so I really want to emphasize this again. And some of you might be familiar with Leslie Hagen from the Department of Justice, Office of Legal Education. She has done some presentations around the region, and this is her quote, that strangulation is homicide on the installment plan. And that's not really meant to be humorous. So think of strangulation as the ultimate power and control, where a victim can be brought to the brink of death by the perpetrator and brought back again, sometimes over and over again, where the perpetrator has this ultimate control over their victim. The terrifying experience for them to go through these stages, which I'll show you in another slide, about where they feel like they're going to die, and the person brings them back to life again. And there are a lot of strangulations, and it's also something that you don't need a knife or bullets or anything, that you can do fairly easily just with your hands or some type of ligature, which I will define for you. And also this other quote about the best predictor of potential homicide, that the odds of becoming an attempted homicide increase about 7-fold for women who have been strangled by their partner. So please keep that in mind. So here is a fact sheet from the Institute for Strangulation Prevention. And it's, 1 in 4 women will experience intimate partner violence in their lifetime. 68%, which is almost 70%, will experience near fatal strangulation by their partner. And then you can see with the other pies here that loss of consciousness can occur within 5 to 10 seconds, death within minutes. 97% are strangled manually, meaning with the hands. 38% have reported losing consciousness, 35% strangled along with sexual assault, and also 9% have reported they were also pregnant at the time. And 70% reported that they believed they were going to die. So this is a really good visual, and it's free to download from their site. If you are trying to bring some strangulation education into your community or your agency, there are some good resources for you to use. So types of strangulation. There's manual, which can be one hand, two hand, and the chokehold, which I think people are probably pretty familiar with the chokeholds because of the frequent incidences that we've had in this country where unfortunately, where some law enforcement people have used chokeholds and they have caused people to die from the chokehold. Also, the ligature, which is like an object around the neck. Think of a rope, a cord, a shirt, any kind of thing that's going to compress the neck. And hanging is like gravity with ligature. And what that you may think of like hanging is just maybe hanging from a tree or something up above. Maybe thinking of like a beam in a room or something. But also you can have a hanging with gravity with ligature, like from maybe a bunk bed or a bed, where someone can do that to themselves without necessarily hanging from something from above them. So some facts about strangulation, that strangulation is not choking. Choking is like something caught in your throat, like food or an object lodged in your throat. But most of our victims will say choking rather than strangulation. So strangulation is caused by a manual force, like having one or two hands wrapped around the neck, pressed on the neck, a forearm pressed on the neck, or wrapped around the neck, kneeling on the neck. A foot can be on the neck. And again, strangulation is also caused by a ligature, rope, phone cord, electric cord, shoelace, or by hanging. And I took this from a really good brochure from the New Beginnings program out of Zuni, New Mexico. And that is, it's danger, seconds to unconsciousness, minutes to death. Really important to remember, strangulation happens fast. It can take about 7 seconds to become unconscious. It can take 14 seconds to go into a seizure. According to the PowerPoint by Gail Strack, she has that it can only take about 15 to 30 seconds for the body to start to shut down, lose control of the bladder and bowels. And often you will see that a person may be unaware that they have urinated or lost control of their bowels. And according to her slide, it can take between 1 minute and 2.5 minutes to actually die or go into brain death. And so these facts that I also got about strangulation, that strangulation is also one of the most lethal forms of violence. And I really want to emphasize that, because many of the people that we see will say they've been choked, but I'm okay now, you may hear. And so often it's like, if you don't know any more about that, you might think, okay, well, they're okay. And so hopefully I can show you in the next slides how lethal strangulation is. And so again, it can only take 10 seconds to lose consciousness, and maybe even longer, 4 to 5 minutes until death occurs. You know, again, depending probably on the pressure. And a person can die within 36 hours after being strangled due to internal injuries. And I will show you some of the next slides. So again, the person may indicate that, yes, they choked me or strangled me, but I'm okay now. My throat's a little sore, but I'm okay. And then they may go on even after going to the hospital. And if they're not carefully assessed, they may go home and really get into trouble. So strangulation occurs when the blood vessels and air passages are closed by external or outside pressure on the neck. Strangulation stops oxygen to the brain and blocks the airway. So this is a research that was done by McLean et al. And what they found, that there were like 4 stages that the victim's experience was of before they lost consciousness. That like in stage 1, the overall feeling was, I can't believe, or I couldn't believe this is happening to me. Then you go into stage 2, a realization that this is really happening to me. And then the primal, the basic struggle to preserve life, and where you may see on a strangulation victim where they have lots of scratch marks on their neck. And that is the victim trying to get the perpetrator off of their neck, removing the hands, the ligature, whatever it is, the struggle to breathe, to preserve their life. And then the stage 4, the resignation, is he is going to kill me. And if, and then the feeling of their children. What about my children? Will they be okay?
So I have a question in the chat. How common is fatal after 36 hours of strangulation?
That's a good question. I don't have an answer for that. I would think there might be some research that's been done on that. I don't have that, and maybe I can help you in some of the next slides to show you, because every situation is different. So I don't have a good answer for that. And maybe some of the next slides might give you a better indication of that. So here is kind of just a good visual of what your larynx and vocal cords look like. And you can see, and as feeling your own vocal cords and your neck structure there, it's not real solid, you know, so it's easy to push in. If you've ever like exercised and then you're feeling your carotids and counting your heart rate, that's pretty easy to do. And they always would tell you, like in an exercise class, you know, don't feel both of them at the same time, because you don't want to cut off your circulation back to your brain. And then here is another picture. And my anatomy is a little rusty, so if you ask me too many anatomy questions, I may not be able to give you a good answer that. And I have an example of my rusty anatomy, as I had just received in my department some pretty good anatomy models, and I was showing my colleague a vagina model that I got in, and I was showing her some of the diseases on it, and I was holding it upside down. So again, I am a little rusty with that, with my anatomy. But here, another picture of showing the arteries going up to the brain. And I don't want to make this really into anatomy presentation, but I wanted to give you, you know, a good picture of how that goes up and how close that is to the trachea and larynx. And here's another picture that's a little clear about the blood return. So thinking about your carotid arteries, that they're carrying the oxygenated blood to the brain that's coming from your heart. So 11 pounds of pressure to cut off that blood flow to the brain. And so when you think of when you open a can of soda, it takes 20 pounds. So probably almost about less than half of that pressure can cut off the blood flow to the brain. And here you can have, again, 7 seconds of occlusion can go into unconsciousness and loss of memory. 15 seconds, and it's not, again, I don't want to say exactly 7 seconds or exactly 15. You know, everything kind of depends on maybe how much pressure the person is putting on, if the victim is able to move away where the hand is released for a short time. But again, 15 seconds of occlusion can lead to a possible brain infarct, which would be a stroke. And I have some pictures just to show you of what a stroke would look like, or a brain infarct. And so here's just another picture just showing the neck and where the vessels are, how close they are to the side of the neck. And I want you to think of, also the occlusion or blocking the vessels going up to the brain, and also what's happening too if the blood flow that's coming from the brain is blocked, and how that can have a buildup in the brain or a congestion of blood in the brain, and how dangerous that could be. So here, there's some pictures of the white spot, which I'm showing here, may be an occlusion of the brain that's showing where there is damage to the brain of probably could be a stroke, or where a blood flow. And then over here is another picture of where an infarct or an occlusion there to the brain. And this here would be like a carotid artery dissection. And think of it as a shearing. You're still able to get some blood flow to the brain, but there is some damage. And this is what may not show up until later. And this might answer the question of maybe the person didn't have a stroke as what we may think of, as you think of maybe a stroke as maybe an older person having, where some of the signs might be facial drooping, or one side not working as well. But like something like this, you may go on for quite a while, days or even longer, and not even know it. And so here's some more severe damage showing. And here's another one showing some shearing. And so if your emergency room is not looking for this, because maybe the victim says, oh, I'm okay now, there isn't any evidence of any problems, they may not do any more testing and specific testing for that. So this is a pretty good visual that's also you can download from the Institute, the Training Institute for Strangulation Prevention. Now, I really want to make clear that this is kind of to show you of all the different things that could happen. But sometimes there aren't things that are happening. Like there aren't the petechiae, which is the broken blood vessels that you might see in the eye or around the eye, or any bruising, or any like ligature mark around the neck, or scratching marks. The person might have a raspy voice, or they may not, or they may have breathing changes. They may have one thing that's obvious, they may have several, or they may have none. As I mentioned in, I believe, one of the earlier slides, that a certain percentage of people have no symptoms. So here is, may answer some of that question that was, with a delayed fatality. Death can occur days or weeks after the attack due to the carotid artery dissection and respiratory complications such as pneumonia, um, ARDS, and the risk of blood clots traveling to the brain, which would be like an embolism. So some of these things are more kind of nursing, medical specific, but what I showed you also with before, I'm also afraid to back up, but here, I hope you're seeing my cursor. Are they? Okay. Here, like there's this shearing and maybe a little piece of the tissue could break off and now travel to the brain and cause a stroke or an embolism. So that would be a blood clot traveling to the brain. And then there's a psychological injury, which I have another slide to show. And then unfortunately, there is also pediatric strangulation. You may or may not see some of these things. And this is, anything with children is just, I mean, it's terrible with adults, but the idea that this also happens to children and, the terrifying event that this would happen if the child survives this, and they may have the same things going on in their brain too as an adult. But again, you may not see anything. So I'm showing you this next one just because it's real different and really specialized to interview a child. And so of course you would probably have some special training for that because you have to really be at the child's level, their age, what they understand. And this is just showing like with probably a styrofoam mannequin or a teddy bear, asking them to describe what happened to them. And I would think that would probably be within a forensic interview or a specialized person that had the training, like with uh, domestic violence training for this or sexual assault training. Okay. So what we've learned from research. So I just took some research from like the Institute. And so that studies have shown that patients are really okay with IPV, intimate violence or domestic violence assessment when done in a private atmosphere. So if you're in an emergency room that's really busy and other people can hear you, if you're in one of those places where there might be a curtain between each exam area, people might not feel really comfortable talking about what they've done, what's been done to them. And they also need to be asked specifically about strangulation and really are calling it choking because people may not be familiar with the word strangulation, and that through the research that there was no harm in assessing for domestic violence or strangulation, that it didn't make it any worse for the individual. And by finding out if this has happened to them, including that in your assessment for domestic violence, that it's really important to include strangulation. And because that can improve the health and safety for the victim, because you will know more about what kind of danger that person is in. And also, if you don't ask it, and I'm saying you in generally, you may not be the person to ask it who's ever on this present listening to this presentation, but it is a missed opportunity, and patients can fall through the cracks when we don't ask. And often when someone has um, had a fatality from strangulation, there's a group of people, it can be within an agency, sometimes it's a state agency, sometimes a tribal agency, or it can be like a multidisciplinary team. It's usually multidisciplinary, but sometimes it can be just tribal, multidisciplinary, and they can go look back at like hospital records, agency records, and see maybe this person came in, it wasn't documented that it was asked about strangulation. And for most of us that are in the medical health provider field, and probably anyone dealing with, well, I can't say for advocates because I don't know, but for sure. But if it isn't documented, it didn't happen, even though people could swear they asked it, the patient said yes or no or whatever. If it isn't documented, it's considered that it didn't happen. So there's also, legal liability for that, and can become a risk management issue. So also, the Institute found that 300 strangulation cases that were looked at in the San Diego area, that 50% had no visible injuries. That's 150 people. And 35% had insignificant to minor visible injuries, and 15% had significant injuries. So that's really something to keep in mind. And at Shiprock, we have really done quite a bit of training, and we're in process of doing more training, and now looking at making it mandatory for people in the emergency room, the providers, that they have this training so that they understand that many people do not have significant visible injuries. And also some other strangulation study findings were, again, the strangulation victims had a history of domestic violence in 89% of the cases. And this too is that in over 50% of the group that was studied, children were present. So think of how traumatizing that is for a child to see their caretaker or parent being strangled, and how that can affect them. And if you're familiar with any of the ACEs studies, and that we know now, where before you might have intuitively thought, well, when children are witness to these kind of things, that it's going to affect their psychological and their health later on in life. But now we have a good study that really is significant, that shows how later in life children are affected by this. And that also people that are strangled are reluctant to seek medical attention. So we can have I don't have any indication with this study about why, but there may be some shame involved with that, or maybe if they don't have any visible injuries, people might be reluctant to go. And if we don't have good training, we might not feel that our agencies or facilities are safe places for people to go to, that we will ask the right questions and ask them and be able to assist them with the resources, be safe, and be confidential. And sometimes when people are repeated victims of violence, we have to, as providers, whether you're a health provider, an advocate, sometimes maybe our own attitudes might contribute to some of that reluctance of why people may not come to us or confide in us, and where we might feel that we're here to help you and you keep going back or something, and be impatient or less than empathetic when somebody comes back in through our agency or institution. So I'm talking about documentation, looking at healthcare providers, and I don't know, and I'm also looking at advocates or other people that may be assisting victims, where if you're advocating for someone and you come to the hospital, you want to know, and I'm using the hospital or clinic kind of interchangeably here, you want to know what should be asked. And so, I mean, you don't want to be necessarily the investigator but you want to know did the person lose consciousness? Do they have any idea how long? They might say, well, I saw the clock on the wall and I remembered it was 5 after, and when I came to, it was 11:30 now. Did they hit their head? And often in a domestic violence situation with, or sexual assault or both, strangulation, victims, their heads are hit on the floor against the wall, and they may or may not notice it. You may notice that their voice sounds hoarse. They may say they have a sore throat. You may notice or ask them if they had any bowel or bladder loss of control. You may notice it yourself, and they may notice it. You can ask if there was any nausea or vomiting, vision or hearing changes, and then what are you observing? And also, if the victim is pregnant, there's a really high risk of miscarriage. So if you're going in to advocate for the victim and they're assessing the victim, and they're saying, the provider is asking, did you lose any consciousness? And now the victim is saying no, because they don't remember. And so that would be good for you to know, that you can say, well, they did say they remember at 5 after 11. Last they looked at the clock, and when they woke up, it was at 11:30. And so that would be good to know, because maybe now the victim is having some memory impairment. So, and maybe you will notice and observe using your senses that you may notice voice changes. The person may seem like it's harder for them to swallow, like if you've ever, your throat feels thick, like if you have a sore throat, you may notice breathing changes. You also may notice some mental status changes, some bowel and bladder incontinence, where you may smell something. You may smell, urine or feces, or you may observe their clothes being wet, or maybe some neck swelling.
We have one question in the chat.
Okay.
Can anything be done for a pregnant victim to help prevent miscarriage?
Again, I don't know that answer. Probably an OB/GYN person could answer that better. I'm sure if you would be really more closely observed if you were sent home, probably if you were in the hospital situation or an emergency room, they would give you a discharge sheet of things to look for, or maybe be admitted or kept for observation. That's probably the best answer I could give you.
And it looks like Bethany answered the question in the chat.
Okay, thank you. Thank you, Bethany. Okay, and so again, subjective is what are the victim telling you? And so that's, there's what you observe and what they tell you. And again, it's pretty much going through some of the things that I mentioned in a previous slide, but really listening to what they're telling you. And again, listening carefully to what they may tell you. These are some of the things, and I'm looking at the list and I'm like, there's some days I could say this was myself, but these are things to listen. And maybe if you're advocating and you're calling a person and following up with them, whether it's a day, two later, whatever, and again, you want to listen. Do they say, well, I had such a hard time waking up. I don't know why. I seem to sleep so much longer. Maybe your red flag should go up, or any of these things. And there may be other things too, but these might be some things to keep in mind. And so to briefly look at the danger assessment that was originally developed by Dr. Campbell, and then she revised it in 2019 to include an assessment question for strangulation. And so this is an evidence-based assessment. It can be used for free. You don't have to be certified, but you can do a certification class online. And if you want to have the piece of paper that says you're certified, which is like a lifetime certification, it's been done at a minimal cost. And so it's easy to Google and pull up the danger assessment, or you can go to the Tribal Forensic Healthcare site, which is a really good site, and that's free. And they did have a danger assessment training that was available. So this is what it looks like. And this is the Number 10, the new question. Does he ever try to choke, strangle you, cut off your breathing? 10A, if yes, has he done it more than once? Or if he did it, did you pass out or did you become dizzy? So look that up if you're not already using some type of assessment. And this is another one that is a download from the Training Institute. What I've done is I was able to download these and then laminate them so that they, when we do our strangulation training now, that we can give this out and have this available for people. And also, if you're trying to include this kind of assessment, this is really a good assessment to bring to your facility if it's a healthcare facility. And this is, it's just been broken down to two parts. And here's some more assessments that you can, that are available. I put in some other ones. Some people already are doing things like this in the emergency room or sexual assault nurse examiner or a domestic violence examiner may be already including some of these. And I'm just clicking through them. Here's some other ones to go through. So basically, in summary, if you didn't get anything out of this, I want you to know that strangulation is a very common form of violence during intimate partner violence and sexual assault. It's a lethal form of violence and it must be assessed even if there's no visible injuries. You can always contact me for any of my resources, and I'm going to the end here. Like again with the danger assessment, there's an example of, and I couldn't get it into the slide because I kind of messed it up, but there's a Dear Doctor letter that I think was included with the PowerPoint that you can also look at, and also to show to if it's your facility where they're wanting more information. And then there's an example of strangulation discharge instructions to give to people. Also, the non-fatal strangulation documentation toolkit, International Association of Forensic Nurses is a good resource. And the other resources that I have listed here. And I can't believe I'm really was this nervous doing this. But thank you for the people that attended and for my opportunity to use this technology. And please contact me if I can help you out in any way, because this is something we're working on in our facility. And we'll also, I forgot to put on, is I have a sample strangulation policy for an emergency room that one of our facilities is using, and I have permission to share. So thank you very much. And I think that's the end of this.